putting out little fires everywhere. The fate for AstraZeneca as their COVID vaccine faces repeated scrutiny, far more than others it would seem. Some European countries had to back down over claims that it wasn't safe for over 65s. There remain concerns over its efficacy with the South African variant, and the latest has been whether it causes blood clots. Today, though, the European Medicines Agency declared it safe, opening the way for dozens of European countries to restart their vaccinations.
The committee has come to a clear scientific conclusion. This is a safe and effective vaccine. Its benefits in protecting people from COVID-19 with the associated risks of death and hospitalization outweigh the possible risks. The committee also concluded that the vaccine is not associated with an increase in the overall risk of thromboembolic events or blood clots.
They are still investigating rarer cases, and here the regulator, the MHRA, is also looking at 5 reports of cerebral sinus vein thrombosis following the AstraZeneca jab, all in men aged between 19 to 59, one of whom has died.
The causal relationship with the vaccine has not yet been established, and the rate of occurrence of these CSVT events among the 11 million people vaccinated is extremely rare. While we continue to investigate these cases as a precautionary measure, we would advise anyone with a headache that lasts more than 4 days after vaccination or bruising beyond the site of vaccination after a few days to seek medical attention.
But if that is the science, there is also the politics. And again, AstraZeneca finds itself at the centre, unwittingly perhaps, of a row over supply. There was a warning yesterday from NHS England that there will be a shortage in April, though if you have an appointment, keep it, they said. One suggestion is the expected doses from the Serum Institute in India have been held up by the Indian government because of rises in local COVID cases. Another was concerns over export delays in raw materials from the US to India. What is not explained is why the UK is taking the vaccine from the Serum Institute, which is meant to be supplying developing countries. And as if that weren't enough, today the EU announced it will launch a dispute process against AstraZeneca, who they have accused of not fulfilling the contract to supply them the vaccine. Today, the head of NHS England, Sir Simon Stevens, received his first dose of the Oxford vaccine. While across the road, the Health Secretary had another explanation.
In the last week, we've had a batch of 1.7 million doses delayed because of the need to retest its stability. Events like this are to be expected in a manufacturing endeavour of this complexity.
This was repeated by the Prime Minister himself, who also had some personal news.
As it happens, I'm getting mine tomorrow, and the centre where I'm getting jabbed is currently using the Oxford AstraZeneca vaccine for those receiving their first dose, and that is the one I'll be having.
And the government remains confident that it will meet its target to give the first jab to all those over 50 and people who are clinically vulnerable by April the 15th.
Victoria McDonald reporting. So what is going on with the supply of vaccines from India? Well, earlier I spoke to the Indian journalist Mandakini Galot, and I asked her why millions of doses due to be sent to the UK were now being delayed.
The government's position, at least officially on these delays, is that they're not blocking any exports of vaccines, and that these delays are linked to export bans that the United States put in place a couple of weeks ago. You know, they say that in order to make these vaccines, they need certain very specialized raw materials like certain filters, certain bags, which can only be procured in large numbers from the United States. And due to the export ban, this has slowed down the entire production line. Now, this is a position that Adar Poonawalla, the CEO of the Serum Institute of India, which is responsible for shipping these vaccines to the UK, he's also taken a similar position. About a month ago, Mr. Poonawalla tweeted where he exhorted world leaders to have patience with delays that were likely to happen because his company, that is the Serum Institute of India, had been asked to prioritize India's domestic needs over exports. It's a position he's walked back from since then.
And what is the situation in India at the moment in terms of deaths, infections and hospitalizations?
Well, we had a fairly calm winter, but now we're starting to notice a massive surge across the country. In fact, yesterday we recorded over 35,000 new coronavirus cases, and that's the highest single-day rise that India has witnessed in over 100 days.